Ladies and gentlemen, I am going to tell you something about the latest treatment of ear, nose and throat in 21st century. It is that century where we are quite comfortable by various inventions like computer, like you see Airbuses, F-16 is there. Such things they were not present in 20th century. Now we are entering into the best era. In the same way, medical, you see, our specialty has also developed a lot. We are dealing the deafness of the community. I am the in charge of Hearing for All program. I was assigned this duty in Malaysia, Kuala Lumpur, where I represented Pakistan in the 10th Asia Oceania E.N.T conference. They have given me this responsibility due to my work for the third SAARC E.N.T conference, which I organized in Lahore before that event. They were impressed from my, you see, work. They said, take this message of hearing for all, yani sunna sabke liye. It's a big blessing. As we have got the eyes to see, we have legs to move. In the same way, the ear should be working. If there is some problem with the capacity not to listen, is a big disability. WHO has regarded it as a major disability. However, I accepted the challenge for Pakistan. You can read in the, you see, English newspaper that Dr. Rana accepted the challenge for Hearing for All program in Pakistan. Now I am working on it. I am conducting the free medical camps, as I conducted a free E.N.T medical camp in Sugra Shafi Hospital, Sahara Trust in Narwal, on the request of Mr. Ibrarul Haq, who used to come to me when he was a lecturer in H.N. College. He was my patient. He used to come for his throat and nose checkup. However, with that relationship, he said that come to our hospital, which he has made in a very nice way, in far-flung area near the Indian border in Narwal. And he said that the people are poor, they cannot afford to come to the big cities or they cannot go abroad. Give them some you see, proper guidance how they can treat the deafness of their children. However, I made a program to go there with my team, and there I was received by Mr. Ibrarul Haq, the great singer of Pakistan, and his brother Major Israrul Haq, and the MS of the hospital. And with that, DC Narwal, you can see my photograph that I am going toward the Sugra Shafi Hospital. There I organized the free medical camp, especially for E.N.T diseases. My special interest again was the deaf children. When the people came to know that Dr. Rana is coming from Lahore, can you imagine my time was at 11 o'clock. I was scheduled to reach there. People came at 7 o'clock in the morning, 6 o'clock, 8 o'clock from Daska, from Gujranwala, from Gujarat, from Lala Musa. These are the adjacent areas near Narwal, Sialkot, Pasrur, that they will be benefited even from Ridke. The people were there. There were more than 200, you see, patients. I checked up their ear, nose and throat, and especially after testing those children who were deserving, I gave them the hearing aid, and the other patients, they were given the medical advice, what we can do, what we cannot do. They were very happy. I was very much impressed from the whole system of Sugra Shafi Hospital, because I have visited number of hospitals in India and Pakistan, Bangladesh, Sri Lanka, because I remained the vice president and then I was secretary general of SAARC in Lahore E.N.T conference. I had the opportunity to visit the AIMS, All India Institute of Medical Sciences. I'm the only doctor who was allowed to go there after the fifth SAARC E.N.T conference, which I did the candle lighting ceremony. They gave me the opportunity, respect to me and to my country, that their Health Minister of India, Mr. Ramadas, Admiral B.K. Singh, DG Armed Forces Medical Services, he is also standing there, and then Professor Venkat, E.N.T. President of India, and Professor Rakesh from Nepal. Such, you see, people were there. I did the opening in the ASHOKA hotel. You can see this is the biggest hotel of the whole South Asia. Such hotel I have not seen. It's a big, you see, place where we gathered about 5,000 E.N.T doctors. India is a very big country, more than 40 provinces, population of more than 1 billion and 40 crores. Also from Bangladesh, also from Pakistan. It makes about the population around about 2 billion of the South Asia. And E.N.T specialty is a very important specialty, dealing almost with younger group, with older group, with middle age. But very less work has been done in the past. You can see the example in Pakistan. I belong to this country. I feel proud of it. The first national E.N.T conference was organized in 1981. You can see the photograph in Lahore, not in Karachi, not in Peshawar, not in Islamabad, not in Quetta, in Lahore, the first national E.N.T conference. We are the top people of Pakistan. That is President General Muhammad Ziaul who was the Chief Martial Administrator of the time. He came all the way from Islamabad to the Lahore airport and then to the venue of this E.N.T First National Conference. On my request, when I met him there in Islamabad, I had a meeting with him on 8th May 1981. However, by his coming to this conference gave a big boost up, and all the new trends. He issued a directive on my request that Quetta, Peshawar, Karachi, Lahore should be given the E.N.T Diagnostic Center. A new era of, I'm talking about new development in the treatment of deafness started. There was no post of audiologist. I was working in Mayo Hospital. No. One E.N.T diagnostic then was made in Mayo Hospital. Audiology post was created. The job of the audiologist, again I said, he's like a radiologist, he's like a pathologist. His job is to diagnose the deafness. It should be there. Before there was no post. No post, no system, no instruments, no audiology room proper. However, it gave a big, you see, service to the humanity, that the deaf people, instead of going to England or America for their diagnostic, before 80, the people used to go, those who were affording, they used to go to England, to America. But in Pakistan, they were not having such facilities. I feel proud of that God has given opportunity to our government of that time that they started this work. Then I represented Pakistan in Hearing for All program in Malaysia, KUALALUMPUR, where they said the ear should be treated in a proper way. If there is a perforation in the eardrum, I am doing the laryngoplasty. We can repair the eardrum. If there is a problem with the ossicular chain that is inside machinery of the middle ear, we can do the ossiculoplasty. Then other way, there is a cochlear implant. In Orlando, Professor Jennifer Delivery, she is the top ear surgeon of the world. She gave me the small disc that take this for introduction to your country. However, I then, you see, in my TV program, PTV Lahore, I, you see, put this small disc in which some introduction to the cochlear implant. I'm talking about the latest treatment.
Transform sounds into electrical signals, which stimulate the nerve fibers of the inner ear. This way, speech and sounds can be heard again. To understand the function of a cochlear implant, we will follow the path by any sound under normal conditions. Sound waves travel through the ear canal. And reach the cochlea via the middle ear. In the cochlea, the sound wave is transformed into electrical pulses, which travel down the nerves to the brain. Then the sound is processed. the sound is transmitted at a high speed. The cochlea plays an important role in the hearing process. The cochlea consists of 3 little channels filled with fluid. The incoming sound wave travels through the fluid and stimulates thousands of hairs on the top of the hair cells. The hair cells convert the mechanical energy into electrical impulses, which stimulate the nerve fibers. They form the acoustic nerve, which sends the message to the brain. The low sounds stimulate the top of the cochlea.
This is the latest treatment, but still it is very expensive. It is just at the beginning stage. God will help us that people in Pakistan are affordable to that extent. Otherwise, the other ways, the best treatment is very, very simple. Hearing aid. This hearing aid, if you put the child, this was told in Turkey. I represented Pakistan in the 10th E.N.T Congress in Ankara, which is the capital of Turkey, that this small hearing aid is very useful weapon against deafness in children, in middle age, and also in the older. This small hearing aid we should give as early as possible to the child. We should not waste his time. The more earlier we get this instrument to be fit in the children, the better result are there. If they will start listening, then there is a speech therapy. Child will be able to speak and listen. Both. He will be listening and he will be speaking. He will become a normal person. But if we just waste 4, 5 years, 6 years, then the results are very poor. I tell you very frankly, ear, nose and throat diseases, they make 25% of the whole patients. When I used to work in this MAYO hospital, which is the top and the oldest hospital in North area. One hospital was made in Calcutta, the other was made in Lahore. In Delhi or Bombay, they were made, the British people, they made later on. This Lahore is the oldest seat. King Edward Medical College is the second oldest medical college of India and Pakistan, or rather the South Asia. They made it in 1860. Then attached hospital is MAYO Hospital, where I worked as a specialist, and also I remained teaching the students. And 4th year, final year MBBS of King Edward Medical College. You can see me, I am moving with Professor Iftihar Saab, who was the principal of King Edward Medical College, the unique medical college. I spoke something about the ear problems, that is the deafness, which is a major issue. In next, episode of this program, I will be telling about the problem of the nose, how we can deal with them. Thank you very much.